Hi, I'm Chad Kripe, editor of the Idaho Statesman. Thank you for joining our latest Doctors Q&A regarding the COVID-19 pandemic. I'm joined today by Dr. David Pate, the former CEO and president of St. Luke's. Thanks for joining us, Dr. Pate. There he is. And
glad to be with you.
Thanks. And by Dr. Tommy Ahlquist, co-founder of Crush the Curve Idaho. Thanks for doing this again, Dr. Ahlquist.
Good to be back.
So guys, I really thought we were done with this series of Q&As when we talked about life after vaccination last spring. Instead we're here facing a situation that might be more dire than what we faced last winter or last fall. The Delta variant has proven more transmissible than the previous versions, and there's some talk about whether it might even be more potent than the previous versions. We'll get to some reader questions shortly, but I want to start with some big news this week regarding hospital capacity in Idaho and booster shots of the vaccine. So first of all, this week we had more people in Idaho ICUs with COVID-19 than at any previous time during the pandemic. For both of you, with roughly half the Idaho population vaccinated, why are we seeing hospitalizations rise so quickly?
Well, I'll go first because I remember the last one of these we did, David, and we actually haven't talked about it, but Dr. Pate predicted this then, and basically said, hey, despite vaccinations with these new variants, I think you actually talked about the Delta variant in that episode, and talked about how we really need to get vaccinated, and we needed to encourage everyone because this would be worse and more severe, and you would have more cases of people getting ill and going in the ICU. So there's absolutely nothing surprising about this. It's just happened probably a little later than we thought it would. Might I add, right at the wrong time as we're getting back to school and kind of through the summer months. So I think this was completely predictable and not surprising. And unfortunately, where we sit with current vaccination rates, we know vaccines work. We just need to all encourage as many people as we can still to have them go and get the vaccine, because this is not over, as predicted by Dr. Pate in our last one. And David, I'll let you take it from there.
Yeah, well, thanks, Tommy. It's great to be back with you again. And, I think Dr. Ahlquist is exactly right. This, what we talked about was people, if you think back to last winter, we got hit hard. It seemed like people were excited about the vaccines coming out, couldn't wait to get vaccinated, wanted to get an end to this, get on with our lives. But as Dr. Ahlquist says, unfortunately, I think that the misinformation, the ideologies, a whole bunch of things that come into play, plus what we saw was people that back then were considered to be very high risk really did rush to get vaccinated, but younger people, by and large, felt like the case wasn't as compelling for them because they weren't as likely to get very ill back then. But what we warned of is if enough people didn't get vaccinated, we would have high rates of transmission. High rates of transmission would mean more mutations. More mutations would mean more variants of concern. And we talked about that what the concern was is that eventually one of these variants could undermine the immunity, either from infection or from vaccination, and cause a real problem for all of us, even those that are trying to do the right thing. And so we're seeing this play out. I think we also talked about the fact that the herd immunity threshold was only going up. When the variant becomes more contagious, it just goes higher and higher. And so we don't have a high enough percentage. First of all, we're one of the lowest in the United States. But if you look at Israel, which has a higher vaccination rate than we do right now, they have a higher rate of transmission than we do in the United States. And we're having it bad in the United States. But it's with a virus like this, if you cannot get very high levels of people immunized and vaccinated, it's just not going to happen.
Dr. Ahlquist, I was looking at our the transcript from the last one of these in April, and you talked about being hopeful for fall and hopeful that I see you're wearing your Boise State football sweatshirt, that the football season might be somewhat normal. And now here we are 2 weeks away from football season, and it's going the wrong direction. You also said at the time it would really depend on our behavior. And I'm wondering what you've seen since April that has put us back in this position.
Yeah, that's a great question, Chad. And it's super disappointing for me, and I think for a lot of people, because I think there is so much misinformation out there. I don't know how many times I've listened to our good friends, Jim Souza at St. Luke's, and the doctors and CEOs at the hospitals urging people to be vaccinated, and continuing to hear just horrible misinformation about vaccines. That's been frustrating. And if you go back to that several months ago, it's been a barrage of misinformation. I think locally, I think in the state, I think as a state that probably already had some vaccine hesitancy, we were kind of set up for this. And then it only takes one or two physicians or members of the medical community to get bad information out there, and then I'd get calls all the time as that kind of would go across the internet and the way information is transmitted. It's just hard to combat misinformation in today's world. And so you combine that with what I think is just a lot of people are just not taking this serious still. I look at my companies that we have, and I don't want to single out any kind of generation, but there's also just people that are in their 20s and 30s that go to work every day and come home that just don't ever get flu shots or vaccinated, and they just thought this was over. So I think it's a combination of people that have really bad information that are anti-vaxxers, combined with people that just for whatever reason didn't take it seriously, and now here we are. It reminds me, Chad, of the old Cool Hand Luke quote from the movie, right? What we have here is failure to communicate. Some men you just can't reach, so we get what we had here last week, which is the way they want it, right? I mean, this is we tried to tell people from a public health perspective what was going to happen. No one listened for whatever reason, or were misinformed, and now we're here. I'm super disappointed in the fall. You talk about going back to school and games and congregating again, and all the optimism we had and the hope we had. Now I will say, and David, I'm really interested to hear what you have to say about this today, Dr. Pate, but I don't know. There are people that are vaccinated, and hopefully a lot of the healthcare workers are vaccinated, and maybe that, I don't know how we sustain ourselves through this current surge, and it will go down. I mean, it will go through us and go down, but I don't think any of us can predict how bad it'll be. I will tell you this, getting ready for this, I called several friends, both in Utah and here, that work in hospitals and ICUs, and a pediatric ICU down in Utah. There are pediatric cases of 6 kids. That it's complete lies if you think there's not. Up here, 30 to 40% of all admissions to the hospitals right now, to the hospitals I called, are COVID related. There are more people in ICUs now than there have been. I know personally in my little sphere of influence, I've got 2 friends. One died a week and a half ago from COVID in his 50s, and another one is in his 30s that's currently intubated. So no one's making this up. No one wants these surges to happen. People, and unfortunately, Chad, today, probably listening to this today, is a bunch of people that are already vaccinated trying to help. And the question we all have is, how do we help continue to get the messaging out there? Because this isn't over. We need to keep getting people vaccinated. The booster shots will be coming. We'll need to do that as well. So unfortunately, we live in a world where communication is hard, and countering misinformation is just difficult nowadays.
Dr. Pate, one of the significant moments since our last one of these was the CDC's decision to lift the mask recommendation for vaccinated people, which quickly led to most mask requirements going away. And now the guidance has flipped again, but at least in Idaho, you see there aren't a lot of people wearing masks indoors, even with the new guidance. Was that a mistake? Did that set us on a wrong path, changing that guidance when they did?
Well, I think it was. I mean, I understand the position they were in. At that point, they were getting a lot of pressure back. Well, if we still have to wear our masks, then what's the benefit of getting vaccinated? And so I think the CDC thought, okay, let's tell the people that are vaccinated, because the vaccine's very, very effective. Let's tell them that they don't have to mask, and that will be the incentive. I think the misjudgment was to think that those that were unvaccinated who didn't like wearing masks were going to keep masking. And it really, what it did is it just made, so now, you can't tell who's vaccinated and who's not. So nobody wore a mask. Very few people wore masks. And what happened that has led up to this is because of that guidance, because we said you don't have to mask and those mask mandates came down. Now, all of a sudden, things got much more dangerous, not for the vaccinated, but for the unvaccinated, because when we were all wearing masks, the unvaccinated were getting protection. When we stopped doing that, they became more vulnerable. Also, the other group that I feel horrible for is those that are immunocompromised. And there's a lot of people out there, and they did their best. But the problem is when they're immunocompromised, the vaccine is not going to give them the degree of protection that it gives the rest of us. And so these people, with the CDC's action, now it became very dangerous for them and basically relegated them to, now they have to virtually stay in a lockdown because they can't go out and be exposed to these folks that aren't wearing masks.
Now this week, there's talk of, there's a recommendation for vaccine boosters 8 months after full vaccination. What do you guys think of that decision? And how important do you think those boosters are going to be to those of us who are vaccinated to make sure we're getting those going forward?
Yeah. So Chad, one thing is, I think I continually get questions all the time from friends and family and others that, well, I had COVID, so I don't need the vaccine. It's very important to continue to communicate that because the vaccine specifically is the spike protein, the amount of immunity or the ability of our bodies to fight things off with a vaccine is just so much better than what we would get naturally. They're not the same. And just like Dr. Pate just said, we all have different levels of immunity in our body, the way our bodies react to vaccines and illnesses and how we are protected later on. So the fact that we've always said, I think from day one, yeah, this will probably be something just like the flu shots that you're going to need to get booster shots on. So I'm not surprised. I'm grateful because as we get older and as we have a more immune compromise, we're going to need boosters to help our bodies have the antibodies that we need to fight this. And so I was a little surprised that it came so early, but Dr. Pate, you're with your background, you're going to be able to speak to this a little bit better. But we always knew that we would need boosters to this, and vaccines are better immunity than getting the illness itself. All of these same things that exist in immunology and virology forever are the same. It's been interesting to me to listen to people, again, medical professionals, spewing out things that are just false, that are just 100% false about all these topics. But the fundamentals of immunology have been the same and will stay the same now and throughout the fight as we go forward.
Dr. Pate?
Yeah, let me just build a little bit on what Dr. Ahlquist said. So first of all, he's exactly right. If you'll recall our conversations when the vaccines were first coming out, we said we didn't know how long they would last, but most of us said would be really hard to imagine this is going to be one and done. And so we thought maybe it's going to be a year, maybe it could be 2 years, maybe kind of outside 3 years, but very few of us expected that it was not going to require a booster. And of course, I think the thing that has accelerated the timeline, as Dr. Ahlquist was mentioning, is the fact that we've got so much transmission going on because people don't think it's a big deal if they get COVID, so they're not taking the protections. And what they don't understand is even if you're fine, you get COVID and you're fine, in your body, you have many different forms of the virus that as it's replicating. And one of those times, those slot machine numbers are going to line up, and it's going to be a bad variant. And it's going to, we saw it happen in New York, we saw it happen in California, and when you have a lot of this transmission go on, you're going to develop variants. And what we got with Delta is the first variant that did have some of this immune escape or immune evasion capability. It's not total, thank God. It's just partial, but we're seeing it. And if we don't control the spread, we may see one that's much worse in terms of the immunity. So that is why things got accelerated, and we're going to have to get another booster shot. The other thing is, when we rolled these vaccines out, it was at a time when we were having high numbers of deaths. And so the FDA and the CDC wanted to accelerate the time to the second dose, which in itself is a booster. But because of that compressed timeline, 3 or 4 weeks, depending on Pfizer or Moderna, we knew that was going to also shorten the time till we needed a booster. Typically, you'd like to spread it out a little bit longer because it'll even give the immune system a bigger boost. So this isn't surprising. And we now have several studies showing that, in fact, the effectiveness, now let's be clear, effectiveness against infection. The effectiveness against keeping you out of the hospital, keeping you from getting severe disease, going on a ventilator or dying is still very high. It's only come down a little bit. It's very, very high. But what you're seeing is you're hearing more and more cases of people that previously got vaccinated who are testing positive. They're not particularly sick, but they're testing positive. We call those the breakthrough infections. That's to be expected. So no, this isn't a surprise. It also does not mean that going in the future, we're going to need a booster every 8 months. It may be because we're spacing these out. Now with this boost, it may actually last a number of years. We're going to have to follow it and see.
At the beginning of the pandemic, we were told to wear pretty much any mask we could find, and to some degree stay away from the medical masks because of supply shortages. There doesn't seem to be a lot of guidance right now for what we should be wearing. And I don't know what the supply chain looks like now, but what should people be wearing for masks now?
Well, let me just say this. The most important thing is to wear a mask, okay? And I'll take whatever you got. Wear a mask when you're out and you're going to be around people that you're going to be in close contact, or you're going to be indoors, and these are not people you live with. So first thing is go for whatever you got. Second is I will take somebody wearing a mask properly to somebody having a higher grade mask and not wearing it properly. And when I say properly, I still am seeing large numbers of people with masks down below their nose. It's not helping you or anybody else if you do that. So it needs to be over the nose. Hopefully you've got a little metal band in the mask that you can compress down to mold around your nose. Then the other thing is it needs to be down below your chin. So it needs to be over your nose and below your chin. And then the last thing is on the sides where the mask is, we don't want gaps. One of the real benefits to, you may remember a few months ago, a lot of people recommending double masking. Double masking is very effective. But one of the things that helps is if you put the surgical mask or procedure mask on first, and then you put the cloth mask over it, a lot of times that helps close the gaps. These are oftentimes the biggest gaps, or the fact that it's sliding down the nose. Those are the most important things. Now, the guidance from the CDC hasn't changed. However, this is a much more contagious virus. You can be infected in a shorter amount of time than last year with the previous variants. And we still don't have a good sense of agreement about how important airborne transmission is. That's the air streams in a room as opposed to just the droplets that we do. So you could not be faulted if you're going to be indoors, particularly in a situation with more risk where you're around a lot of people, you have reason to believe not everybody's vaccinated. You could not be faulted for wearing a higher quality mask. And that could be a KN95. That's what I oftentimes wear. Or if I have to be in a really high risk situation, which I certainly avoid, then I will wear an N95. But I think if you're concerned, if you're vulnerable, I think it's reasonable for you to double mask or wear maybe the KN95. Most people aren't going to tolerate an N95 for long periods of time. But again, let me say that's not an official recommendation. The most important thing is wear a mask. Whatever you got, wear a mask and wear it properly.
So going to some questions from readers here. Leslie in Nampa asks, that obviously you're going to get a little bit higher proportion of the hospitalized being younger because the vaccination rate is much higher with the elderly population. But she wants to know, is there an actual significant change in the outcomes by age and health with the Delta variant compared to before? And she says, for instance, what's the probability that a healthy 25-year-old with no underlying conditions will be hospitalized?
Yeah, David, I haven't seen the exact breakdown by demographic, but we do know anecdotally from everyone we're talking to with the people that are in ICUs now, and we'll get better data as more of that accumulates through these recent hospitalizations. But it is younger people that are getting sicker this time and being hospitalized and being placed in the ICU on ventilators. That's one of the striking things as we've been talking to these ICU doctors, that it is younger. It is folks that may not have any of the comorbidities. And so absolutely it is. David, you might have some data, but I have not seen any published yet because a lot of this is coming in now. But in the near future, we'll have some better data on this.
Yeah, let me build on Dr. Ahlquist's comments. I agree totally. So the person that submitted the question, that's a very good question, because obviously if you vaccinate the older individuals at a high percentage, which we have, then obviously the people who get sick are going to be younger. But here's the difference and why I'm concerned and why Dr. Ahlquist is concerned. If you simply protect the older people, then if you look at the hospitalizations today to the hospitalizations last year, what you should see is, because last year, not too many people that were young were hospitalized, you're not going to see an increase in the young. You're just going to not see the older. And so your total numbers of people in the hospital will decrease. And certainly anybody that gets admitted that's younger, it'll increase the percentage. But what we're seeing is increases in the absolute numbers of these young people. Just like Dr. Ahlquist said, we're seeing people in their 20s, 30s, 40s. A few weeks ago, if you looked at the hospitals here in the Treasure Valley of people with COVID, it was mostly people in their 30s. And I don't think people understand what's happening. And the other shift, two other shifts that are happening that are really concerning. Last year, you'll remember, we could tell, who was really high risk. We knew if you were obese, if you had high blood pressure, if you had diabetes, if you were older. I mean, you could pretty much peg who were going to be the people in the hospital. Now, when we look at these 20, 30s, and 40-year-olds, yes, some of them do have these, what we call comorbidities, but there's plenty of them that we have no idea why they're this sick, because they seem to be very healthy. So I think that old mindset of, well, I'm healthy, I'm young, which I'm neither of those things. But I mean, if you're saying this to yourself, I'm healthy, I'm young, I'm not going to be harmed by this. That's so 2020. Okay, that is not now. The other thing that's very alarming is last year, it was extremely rare to see children in the hospital, and to particularly see extremely ill children in the hospital on ventilators and young children. This has changed. We are now seeing many more children in the hospital. A hospital in southern Texas, in southern United States, where they are getting hit real hard right now, they told me that in May, the average age of a child in their hospital was 16. In June, it was in June, the average age was 16. In July, the average age was 12. In August, this month, the average age was down to 5. So this is quite alarming. And I think people don't understand that things have changed, especially I don't think the school boards understand things have changed. Last year, children didn't tend to get infected as often, and they didn't tend to transmit very well. And the ones that did get infected and the ones that did transmit better tended to be over 12. Now, kids are getting infected, and the age group of children that's most efficient at transmitting the virus, 0 to 3 infants. This is totally different. And people have to understand this is not the coronavirus we were dealing with last year.
Question from Zoe in Boise, and several other people have asked this question, and you guys have talked about this before, and I think provided some pretty good advice before, but it's certainly pertinent now as well. How do you have productive conversations with loved ones who are hesitant to get the vaccine? And are there any resources out there that you guys would recommend for people to look at for how to deal with this?
Yeah, I think we've been asked this almost every time, and maybe I'm getting cynical or tired. I don't know. I think last time I said, hey, just be really patient, meet them where they are, ask them, hey, what are your fears? What are your concerns? And just kind of really try to meet them where they are and help them along the way. I'm getting kind of tired of that, to tell you the truth, Chad. I mean, there are really smart people out there that are buying into this misinformation. And I think it's always going to be critical and our moral obligation as healthcare providers to say the truth and tell the truth. And I've started just telling the truth in a little bit stronger way in my own personal circles. There's great information out there. There's great information on almost every hospital website. On, I know we have through Crush the Curve, through CDC, through, St. Luke's has a great resources. St. Al, same thing. But there's a lot of great information. You can find the truth on the vaccines. But what I've found is most of the people now who are not vaccinated, who are hesitant, are pretty dug in. And so I think caring about them and making the point that I think, David, I was just thinking as you were talking, because this is a different virus, it's going to be interesting to watch what happens now when it is affecting our kids. Because I think one of the things last year in 2020, when kids were kind of protected, there are parents and people that may not do something for themselves, but maybe they'll do it for their kids. I don't know. I've lost a little bit of my hope for the humanity we have in our society, and the idea of wearing a mask or trying to do something for public health and helping your neighbor, your neighbor that may be immunocompromised, your neighbor who may have diabetes or an illness that doesn't protect them. But there doesn't seem to be a lot of that out there now. There seems to be a lot of clashing and digging in, and for whatever reason, wanting to kind of fight this public health. I've had the discussion with lots of my physician colleagues and said, what if polio or smallpox or all the other things, that the infectious diseases we fought for years and done a really good job with public health. Why is it so different this time? And why is there such mistrust of the medical profession, of hospitals, of our leaders? I mean, I've listened to the forums that have been put on by St. Luke's and St. Al's and Primary Health and the great information they've put out there. I've listened to Dr. Jim Souza, who here's an ICU doc who I love and have been I admired him professionally. I've listened to him speak many, many times, and people just don't want to listen. So at some point, I think that hey, be really patient and gentle and meet them where they are. I think I'm just kind of tired of that. These people need to get the truth told to them, and the truth is vaccines work. They're effective. They protect their kids. They protect the immunocompromised. It's good for public health. It's what we should be doing as a society, and shame on them if they're not.
I think that, Dr. Ahlquist is a realist and I'm an eternal optimist. So I think that's the difference. I do get frustrated just like he does. But on the other hand, I'll tell you, I've had conversations now in the last few months with mostly one-on-one, some Zoom chats with people, but a little over 50 people that are vaccine hesitant. And 37 of them have gotten back to me that they did get vaccinated after talking with me. So I haven't lost hope. I think Dr. Ahlquist is also right. It may change with this spike, what we're going to go through, because let me tell you, I don't think most people understand what's coming at us. And when people see how bad this gets, there'll be some that will say, okay, I cannot deny this anymore. Now I've seen my own kid get really sick, or I've just lost this friend or family member. I think there still is hope. And in fact, today we are getting somewhat, it's not enough, but we're getting more people vaccinated today than we have over the last few months. What I think is, you have to realize these people are coming from all over the place. They all have different issues. One of the big things, and unfortunately was being promoted by one of our faith leaders, is that people shouldn't wear masks and shouldn't get vaccinated because we should just rely on our faith. And one thing that I have found effective is to, because I'm a man of faith, and I know Tommy is, and what I tell people is, let's just look at the rest of your life, because you need to sort out, are you reacting to this politically or ideologically, or are you reacting to this rationally? If you really want to rely on faith, would you leave your home unlocked? Would you let your kids play out in traffic and that God will save them before they're hit by a car? Are you relying on faith in all the other areas of your life? And of course, very few are. I also try to point out the inconsistencies, for example, for the school boards, just to point out, because they may think they're not handling this politically, but you ask them, okay, forget about COVID. What if this was chickenpox? What if you had a kid show up to school, was sitting in a classroom with chickenpox? What would you do? Well, we know what we would do because we've done it for decades. What you would do is you'd get that kid out of the classroom as quick as you can because of how contagious it is. You'd take them to the nurse's office. You would call their parents, have them come pick them up and take them home so that you don't expose other kids. Well, COVID is about as contagious as chickenpox is, and it causes more severe disease. So why are you acting differently? Of course, you can look at a kid and see they've got chickenpox. You can't look at them and tell that they have COVID, but that's the reason everybody needs to be in masks, because we can't tell who's infected and who's not. But you wouldn't let somebody sit there if you knew they had a contagious disease like this. So if you're acting in a different way, then it's not internally consistent. And that tells you it's political.
Brandy in Boise asks, does the booster shot need to be the same as your original shot, or would you perhaps get better protection by getting the other vaccine?
Well, right now, the recommendation is you should get the same vaccine. Now, the CDC and FDA has said if that same vaccine is not available in your area, you can, like if you got Moderna, you could get Pfizer or vice versa. But if you got Moderna, you should get Moderna. If you got Pfizer, you should get Pfizer. The studies of what we call mix and match to see if you might do better or worse if you got one vaccine and then another, those are ongoing. We don't have that data yet. So right now, the recommendation is get the same one you got before.
A viewer on YouTube asks, will the boosters of the vaccine be re-engineered at all to give immunity specific to the variants, or will this be the same thing we got before?
Well, I think because of the proximity to the last doses, the time to re-engineer, David, I don't think they've had enough time to do that, but I think they have shown that the current vaccine that we had is effective against Delta, and so the booster now is another dose of the same vaccine. Correct, David?
Yeah, that's absolutely right. If you get this third booster shot, your level of what we call neutralizing antibodies that prevents the virus from getting into cells is elevated about tenfold if you get this third shot. So you don't need a new type of vaccine, though Dr. Ahlquist is exactly right. Both Pfizer and Moderna are currently working on a new version, a kind of a new evolution of the vaccine, but we're not going to have that in time. So right now you should get exactly the same vaccine that you got before, and the evidence is overwhelming that it'll be highly effective.
Tina asks, I usually get my flu shot in October. Now I'm eligible for my booster in October as well. What's the recommendation in terms of timing with the flu shot and the booster shot?
We're waiting for that. My guess is that the FDA is going to tell us that people can go ahead and get both. The reason we told people last year, don't get any other vaccine, just before or just after the COVID shot, is we're trying to figure out what were the adverse effects of the COVID vaccine. And if you got 2 or 3 vaccines, we can't tell what you're reacting to. So it wasn't that it was going to be problematic medically for you to get more than one vaccine. It's just that we needed to be able to assess what are the adverse effects of the COVID vaccine. We don't have to do that now. The FDA has not come out, but they will, and they'll give, the FDA and the CDC will give us the guidance about, is it okay to get those shots together? My guess is they're going to say yes, but we'll wait and see.
We've had a couple of questions related to ivermectin and to Ryan Cole being appointed to the Central District Health Board. Those are somewhat related. So, could you guys talk first of all about what the medical community stance is on ivermectin, and also what you guys have thought about the changing leadership of the Central District Health Board and where that might lead?
This is a perfect question for Dr. Ahlquist. Yeah.
I'll take this one. Listen, first of all, elections have consequences, and with 3 Ada County commissioners, anyone that listens to this today, please pay attention to the next Ada County Commission election. I know this is about COVID, but it affects our everyday lives with 3 commissioners and some of the decisions that are being made, and it's just really unfortunate for this and for other things that are happening in our county. Here we have, Ada County, the largest county in the state, and 3 commissioners, and just please vote because the commissioners we have right now are challenging. Secondly, I think Dr. Cole is a very nice person. I disagree wholeheartedly with much of what he says. And I think he's on an island. I think that if you listen to medical professionals who understand the research and science behind what is going in to treat COVID and what we're up against, he is on an island, and I'm very concerned with some of the things he's put out there that are really making an impact and challenging people's daily lives because of the misinformation. So I'm personally very disappointed, and that's a very honest answer.
And let me just add, because I think Dr. Ahlquist is exactly right. Let me just give another perspective. Just like I was talking a minute ago, let's not talk about COVID for a minute. Let's talk about the next pandemic and how we're setting things up, because we have honest arguments. Some people think COVID's no big deal. Others, like Dr. Ahlquist and myself, think it's a big deal. Let's forget about that. Let's think about the next pandemic, 3, 5, 10 years from now. Dr. Ahlquist and I can tell you off the top of our heads a dozen viruses that, instead of a case fatality rate of 1 to 3%, which is what COVID has been, we can name viruses that have a mortality rate of 30 or higher %. Now, let's assume the next pandemic is one that is killing a lot of people. It's overloading our hospitals so that even if you don't have whatever that disease is, you can't get in the hospitals. It's even striking all the healthcare workers, and that there's a lot of viruses, unlike COVID, how it started out, that do go after kids and in a bad way. And now we have a lot of people losing their children. Let me tell you, our view as a community is going to be a lot different about public health if that happens. And that could certainly happen. What we should be concerned about is all these games being played where the legislature is trying to do a power grab, trying to take power away from public health districts so they can't give mandates and orders. I get it. People don't like those. But let me tell you, there's a lot of people that try to figure, and our schools a lot of times have tried to figure out that what they should do by what is the order or the guidance of the public health. If the public health agencies can no longer put in orders and say, hey, you need to stay home, or you need to wear a mask, or you need to do this or that to prevent whatever's coming next. And if we populate these public health boards with people that are giving you misinformation, we're going to hurt huge numbers of people, and nobody will be able to trust anything. So I would, frankly, if that's where we are, is that we're going to say the public health boards can't do anything, then fine. In exchange, if it's going to be every man on their own, then in exchange, let's either get rid of the boards or let's agree we're only going to put experts on there that will give us, at least if you're not going to make the orders, at least tell me what the right thing to do is, so that if I do want to protect myself, my family, I can do that. I've got good information.
And then on the ivermectin, I did want to hit that. We had a story recently about the fact that the usage has gone up in Idaho. Can you guys talk about why that is frowned upon by the medical community?
Well, I think it's frowned upon because the evidence doesn't support the use. There was an early study that has now been seriously challenged because it showed extremely positive results that couldn't be reproduced. And now it's been found that part of the study was plagiarized. And we've had this happen before, but because of a pandemic, in a rush to get information out there, some of these journals have gotten information out before it's really been scrutinized. And now we cannot show that it helps. In fact, the evidence tends to suggest it hurts, but you can't change people's minds. What is really baffling to me is, explain to me why you want to take ivermectin, which does not have FDA approval for COVID and does not even have an emergency use authorization by the FDA for COVID, but you tell me you won't take a vaccine that we have way more data on, and we actually have an FDA emergency use authorization for that. If your whole objection to taking the vaccine is because it's not FDA approved, why in the world are you taking ivermectin?
Rick, and this kind of hints at some of what you guys talked about a minute ago with Central District Health. But Rick in Coeur d'Alene asks, he says, throughout the early stages of the pandemic and last year, we relied upon guidance from the governor's office, the CDC, and Pate and Ahlquist to establish safety protocols and keep our institutions operating. As we begin this academic year during this rapidly escalating surge, there's an absence of meaningful guidance. What advice do you have for people to get through this? And what are you seeing from this sort of lack of guidance?
Well, I'll take that one too. It's an election year, right? I mean, primaries are coming up and people are doing what they need to do to get elected. And I don't know. It's going to be a challenging time. I think, and I think Dr. Pate would agree with me. We're in for more illness and sickness than I think people are aware of. And I think that they're tired of restrictions. They're tired of mandates. But you're going to see these things start affecting younger people, and ICUs filling up, and someone's going to have to lead. I also, one other comment, I think that there's that extreme irony and hypocrisy from so many people who are all for local control, and then they want that control back. I mean, the legislature. I mean, the threat of a new session so that they can control things that happen below them when in the next breath, they hate the federal government for controlling Idaho. So, and then it's the same thing down one other level, right? The hypocrisy from leadership and politically during this entire pandemic has just been one, frustrating, but just super disappointing. I can't tell you how disappointing it is to watch people talk out of both sides of their mouth on COVID almost every day from the political side of things. But I think that leadership will have to come because they're going to be forced to lead. And I think that's coming very soon if these numbers continue to go like they are. I think you've heard people have been quiet because they haven't wanted to step out for fear that they're going to get primaried and have a problem coming up. But I think you'll see that change soon, because it's going to have to. At some point, that bell's going to be rung, and they're going to have to come out and into the ring and take a stance. And I look forward to that. I think we need it. I think we need guidance. We need direction. I applaud people who have not stopped saying things during this, like Dr. Pate, a very consistent message, but it's been hard to watch from afar, I'll tell you, because we need leadership worse than ever.
Yeah, well, I agree. And I think that we need to call on school boards to say, it started out with school boards. They would have people from the public health district come and explain things and answer questions. They don't do that anymore. In some cases, they will talk to doctors, but then they don't represent correctly at the meetings what the doctors are. They used to have doctors come and talk to the meetings. And I think for those of us who have not lost our minds, that want to get over this COVID, want to get things under control, want to protect our children, I think we got to speak up, and we got to hold these school boards accountable, and we got to hold the Ada County commissioners accountable, and we got to hold the legislators who have been crazy accountable. And so if you're of sound mind, you need to show up and vote.
Adrienne in Boise asked, I think this is probably on a lot of people's minds. She says her and her husband are agonizing about whether to send their kids to school. They've got a fourth grader, obviously can't be vaccinated. They've got a preschooler, can't be vaccinated. She wants to know if the steps, she said the schools are taking, steps in terms of ventilation and staggering lunches and wearing masks, but is that enough to protect her kids? And she'd like to know if hospitalized children are coming from vaccinated families.
Yeah. So I think it's very district dependent, and it depends on how much viral loads in the community, and it depends on the situation in your individual school. But I am hopeful that they will follow regulations and guidance. Again, Dr. Pate's right on. They're not asking those questions. There are protocols of ways to keep schools safe. With Crush the Curve, we're helping school districts all around the country right now. We didn't really get into it today, but there are lots of school districts that have these protocols that are tests to stay in school. And just like Dr. Pate mentioned, the second an illness comes up, that you're able to identify who's positive and keep them out. There's protocols to keep kids in. There's protocols that people are following. So there are a lot of folks around this country that are very focused on doing it right and keeping kids safe. And I just hope and pray for Idahoans and our communities, that the local school districts, that our the state school board, that others will look at those protocols that keep kids safe and follow them. But it's a very it's a tough question, because each district's doing it so differently.
Yeah, and I think what you may want to do, like I've advised my own family members to do, talk to schools, see what they're doing. I had hoped that over the summer, the schools would take a number of steps that would make the schools safer. I haven't heard that they have. Part of the problem is the schools aren't telling us what measures they've taken. What are they doing about ventilation, air exchanges, filtration, and so forth? What are they doing about how to ensure safe meal times, which are going to be high risk because all those students take their mask off? But there's a small group of us that advise schools, and the schools aren't asking me, and I haven't heard that they're asking my colleagues, so I don't know what they're doing. So we need to ask the schools, what steps have you taken? If they tell you that, well, we're focusing, like like the West Ada superintendent did, well, we're going to focus on hand washing and cleaning surfaces. Well, then they don't understand how this virus is transmitted. And if they're allowing kids to wear face shields, they don't understand how this virus is transmitted. If they're relying on plexiglass, they don't understand how this virus is transmitted. So I'd ask your schools, what are they doing? Though, I mean, the good and bad thing about Delta, certainly what we're seeing in other states, is the outbreaks are going to happen very quickly. In many schools, they're happening in the first day, 2 days, 3 days. Mississippi has just reported in the first 2 weeks, they have, compared to the first 2 weeks of last year, there are 30 times more kids infected, 6 times more staff and teachers infected, which certainly does raise the question if vaccination rates in teachers are as high as we've been told. And they're seeing huge numbers. Mississippi's got almost 25,000 children in quarantine. So we're probably going to see it soon. Now, Mississippi has a lot higher disease transmission than we have. So maybe it won't be the first week, but I bet it won't be very long till we see it in the schools if they're not taking good precautions.
Bob in Boise asks, and this is, you guys have hinted at this a little bit, I think, but he wants to know what the worst case scenario is. If not enough people are getting vaccinated, this continues, what's the worst case scenario we're looking at here?
Well, I think the best case scenario is that it's not as bad as we hope, but we're already past that. I think Dr. Pate's hit on that. I mean, if you look at current ICU rates in the state right now, they're worse than they were before. If you look at admission percentages that are COVID and ages, I mean, the data we have right now is already worse than it's been. So I think we're already farther along than most people think we are right now. So the worst case scenario is it continues to grow. We have our hospitals overwhelmed. There's staffing shortages and rationing of healthcare. That's always been the concern. And then you just look at the individual toll. If we have more of our people and our death toll goes up and people are sick on a disease that we could have contained and prevented, that's a pretty bad case scenario. And I think again it goes back to, I guess one of the things that I'll say as we kind of come to the end of this is you think about what a rallying cry this could have been for our country and communities if everyone would have just come together and worked together on trying to combat this virus. It could have been one thing that would have brought us all together, and we could have had success together, and we would have helped each other and our neighbors, and we would have done it together. And instead, for lots of ideological reasons, it's something that we continue to battle about. But we'll know soon, because the data will show hospitalizations, morbidity, mortality rates. That's what will be followed, and it could get bad in the coming weeks and months.
Yeah, and let me just add a little flavor because Dr. Ahlquist is exactly right. So here's the bad things. We're spending a lot of time talking about the mental health of children because of wearing masks or not being in person in school. Well, the worst thing is that we're foolish about bringing kids back to school because there's safe ways to do it. If we don't do it safely, we're going to have big outbreaks. That's either going to push all the kids to remote, or it's just going to have lots of kids in quarantine. And those very parents that are pushing for no mask are not going to be happy when their kids are home because it didn't work. So that's one thing that's going to happen. Another thing is, what we're forgetting is the impact to kids when they lose their parents. In Texas, a family with 4 children, both parents got COVID because they did not get vaccinated, both got in the hospital, and both eventually died. These are 4 children without parents right now. And the mother's last words to a friend was, make sure that my kids get vaccinated, because she realized the mistake she made. Another worst case, these hospitals continue, maybe they don't get overwhelmed, but they continue to get hammered like this. And we're losing people that are just burning out and saying, I'm just going to do something different. We could lose our very valuable healthcare providers. And even worse, if they do get overwhelmed, that means if you have a heart attack, if you have a stroke, if you have a car accident, you may not be able to get the care you need at the time we would ordinarily do it, which may impact your outcomes. There may be cases where we're going to have the hospitals full. And like the other day, we had to have people from another state flown here for care because that state was out of beds. We could be in that position where we need to fly people out of Idaho for care. The question is going to be, where are we going to send them? Because other states are all filling up too. So people don't understand how bad this could get. It can get way worse than you think.
Kate asks a really good question. Is there a timeline at all for the under 12s to get vaccinated?
We don't know when that FDA authorization is coming. We're certainly, we know the FDA understands lots of kids are getting sick. We need to get on with this, but they did ask for extra data because they just want to be extra sure that the vaccine is safe. As a general internist, I learned a long time ago that kids are not little adults. They're an entirely different species. And so we have to be careful about these studies. We're hoping this fall. Personally, I'm hoping maybe October-ish, maybe November, maybe. I don't know. It could be very soon. It could be as late as the end of the year. We just don't know. We're just going to be ready to go, hopefully. And I hope people will get their children vaccinated.
And last thing for both of you guys, I watch this and worry a little bit that, we got very close to crisis standards of care in November, December, and there was a lot of talk about that, and we avoided it. And there were a couple of times in the last year where it got really bad, and then we turned a corner, and there really wasn't a great explanation for it, but we turned a corner.
Right.
And it's getting really bad again. And I get the feeling a little bit that because it sort of turned a corner the last couple of times, that people just expect it's going to turn a corner again. And I wonder, do you worry about that there's maybe that fatigue a little bit and people aren't quite ready to buy into how bad this might be right now?
Chad, I agree with you completely. I think every time it's happened, it's gone away. And sometimes, to your point, we didn't know exactly why it went down when it did. And there are more people vaccinated now. And maybe we don't hit that point where we're over the edge. But I hope for people that listen, that they will listen to the hospitals, to the ERs, to the ICUs where this is happening. And we can get that information out. I hope it drives people to become vaccinated, because we are, all the things that people want, that are hesitant about vaccines and hesitant about masks and mandates and regulations, all the things they want and they're fighting for, the pathway to get there is through vaccination. The pathway to get to those same things is through public health. I love what Dr. Pate said today, which is check yourself. And if you feel differently about, chicken pox than you do this, then it's politically motivated. We need to get back to trust in public health and trust in medical professionals and coming together as a community to combat infectious diseases. And somehow we've lost that. So I'm hopeful that people will listen. And if it gets really bad, then I think you'll see more people listen, and that will be a positive outcome of the crisis. But we need to all help each other with the misinformation. We need to all help each other. Probably sound cynical and kind of tired of this, because I am, and I know that a lot of people are, but we can't give up. We've got to continue to help and try to help those that can't help themselves and that are less fortunate. Those are the kids that can't be vaccinated. They are those that don't have health care. They are those that are immunocompromised, and it's worth the fight. And we really appreciate the chance to be on today to talk again about it.
I couldn't have said it better.
Well, thank you guys. We really appreciate the two of you have been willing to share your time with us to do this repeatedly. And sadly, I think we'll probably be doing it again. Like I said, I really hoped that we were done with this a few months ago, but really appreciate your guys' perspective and your expertise and what you're able to bring to this. And so thank you so much.